Okay, good morning, colleagues and friends. Like Barry, I would also like to extend a very warm welcome to all of you to the National Health Laboratory Services in the first instance, and to South Africa. You had an opportunity, I think, yesterday to see a little bit of one part of South Africa in Rosebank, and I should stress that only one part of South Africa. Before I get into kind of sharing some thoughts around the role that your organization plays, maybe just a very quick introduction. The National Health Laboratory Services is the single provider for laboratory services for the public health system in South Africa. So we serve about 80% of the population with respect to laboratory service needs. And in addition to that, the National Institute for Public Health that Professor Shub heads up is within the institute, and we have two other parts of it. The other is the National Institute for Occupational Health, and the third part is the fourth part is the National Cancer Registry. So just for you to get a sense of who we are, we're a parastatal, so we public sector, but we function independently of the rest of the public health system. We really support what happens within the public health system, but have the flexibility to run the institution with very little interference from the Ministry of Health or from the various departments of health in the country. The President, Jeffrey Kaplan, the Vice President, Dr. Barry Shub, the head of the National Institute of Public Health. It's a real privilege for us to have so many of you here at the Institute and in South Africa at this point in time. In talking to Barry yesterday, I know that all the who's who in public health is sitting in this one room at the moment. So it's quite a privilege for us to have such a body of knowledge in South Africa beginning to address your minds collectively to the challenges that face the country at the moment. Now, I'm not going to refer to the organization in its full name, and I haven't quite got around to the acronym yet. So for now, I'm just going to call it the association for your benefit. I know that the association has been in existence for just 4 years now, Jeffrey, when I spoke to you last night. But my sense is that this organization couldn't have come at a more important time. I think that the world is faced with some of the most serious public health threats at this time. And I think having an organization of this kind will play quite a critical role with respect to responding to the threats that face us as we sit at the moment. The reality that we're currently faced with is many of the gains achieved over the last 2 decades can easily be reversed if we don't work together to develop affordable and sustainable public health strategies for particularly the developing world, but I think more especially for the world in general. Your role in working with developing countries, particularly the National Institutes of Public Health, to strengthen public health capacity and transform national and global public health is absolutely crucial, especially at the time that we're currently in. There's a global meltdown when all countries are placed under severe economic constraints. And this is especially true for the developing world, but more especially for the African continent. Giving attention to this need remains a huge challenge globally, but more especially, again, to us here in the developing world. We're delighted that South Africa, but more especially the African continent, was chosen to host this meeting. Because I think it's absolutely critical that we give recognition to the challenges that face us on the African continent. And I think by hosting the meeting here, it raises the crisis within Africa. On average, the challenges here, and I include South Africa in this, the challenges here are the greatest. Our infrastructure is the weakest, our human resource capacity probably the worst globally, our systems the most basic when compared to many other countries in which you work. We appreciate the role that the association plays in bringing together institutes in the north with that of the south to pool scarce expertise, share lessons, and I know also to mobilize resources to jointly tackle the issues. We can sit by idly and watch while the gap between countries in the north and countries in the south widen. And if you look at any literature today, we're seeing this gap getting wider and wider, contributing to further inequity and potentially new global threats. Just to illustrate the income inequality, and I'm sure all of you know this already, but I think it's important that we remind ourselves. The income inequity between rich and poor countries. The world's richest individuals have a combined income greater than that of the poorest 416 million of the population. 982 million people out of the developing world's 4.8 billion people live on less than $1 a day. Another 2.5 million, and that constitutes 40% of the world's population, live on less than $2 a day. In addition, the poorest 40% of the world's population accounted for 5% of the global income in 2005, and the richest 20% accounted for 75% of the world's income, and the richest 10%, 54% of that income. So it just illustrates the inequity that we're currently faced with. The sad reality is that the 10 poorest countries in the world are on this continent, on the African continent. The tragic reality for many of these countries is, despite the advances in medicine, the health status of women and children in particular have gotten worse in the last decade. The health of people living in developing countries around the world has improved considerably over the last 2 decades. Excuse me. For example, the total number of deaths annually among children less than 5 years of age have halved over the last 40 years. Unfortunately, in most sub-Saharan Africa and some parts of South Asia, these reductions in mortality have stagnated or even reversed in the past decade. At the same time, disease patterns and causes of death in less developed countries has changed markedly. The most obvious example of such changes relates to HIV and AIDS, but others include the re-emergence of tuberculosis as a global health problem, the emergence of new infectious diseases, the increase in violence, the emergence of chronic diseases, formerly thought to be of concern only in developed countries, such as coronary artery disease. So we've got the quadruple burden of disease that face the developing world. We know that financial resources alone is not going to resolve this crisis. And I think South Africa is a good example of this. Despite the high expenditure and per capita, in the last 10 years, we've seen declining health indicators for South Africa. And if we compare South Africa to many of the African countries, we're doing quite well if you compare per capita spending. But despite this, we've gotten worse. And in fact, some of our health indicators in South Africa are probably worse than several African countries that have resources that are way lower than we have. So my point is that financial resources alone is not going to resolve this crisis. And I think that this crisis has been compounded by poor leadership in health in Africa and in Asia, poor policies, management inadequacies, and poor implementation strategies amongst some of the kind of challenges. This calls for multiple interventions, together with increased resources. Strong political leadership and political commitment is going to be absolutely crucial if we're going to achieve this. And I think that this organization has the potential to bring institutes together, but to mobilize political leadership to do something tangible on the ground. So I'm delighted that the conference is happening here in South Africa. I'm hoping that there would be some important recommendations that will come out of this for the National Institute of Communicable Diseases and the National Laboratory Services, but I'm hoping that we'll also begin to influence what happens in the countries from which you come. Now, while you're going to get an opportunity to visit the laboratory services, I think you should also see a little bit of South Africa while you're here. It is a great country. Next year is the 2010 World Cup, so I'm hoping that you'll come back for 2010. And I'm told that Barry is ready for all the challenges related, the public health challenges related to 2010. So thank you very much for offering me this opportunity to share a few words with you. And I wish you good deliberations over the next 2 or 3 days. Thank you very much.